our legislative delegation that's here. I want to thank them for their participation and support for our fight against COVID-19. It's made a difference with our businesses. It's made a difference with our support for hospitals and how we've trying to pull ourselves out of this. And then we're glad to be joined by Dr. Nate Smith, our Secretary of Health, and I want to thank Chancellor Alexander for a wonderful face mask from UAPB. And so this will be a good part of the collection. I got a feeling all of these will wind up in my archives, and we're very proud to have that connection. I did want to mention one thing of a personal nature from me, and that is the recognition of a life well led but has passed, and Dr. Raymond Hull of Rogers, Arkansas, who was my family physician years ago, has passed away because of COVID-19. And I just wanted to recognize his life, his contribution, and it's just another consequence and reminder to us of the deadly nature of this virus in many circumstances, and he fought a very hard-fought battle and has come, but his family is wonderful. We are grateful for our history with them and wanted to recognize his life and his contributions. And now let's go on to our case report, which is of statewide interest, of course. Yesterday we had 9,740 total COVID-19 cases, and over the last 24 hours we've had an additional 340 cases statewide. I asked Dr. Smith to check, and he verified that of those 340 new cases, only 2 of those are in Jefferson County. And so a breakdown of that statistic locally. With the 340 additional cases, that brings us over the 10,000 mark. So we have now had 10,080 cases. Of course, over 6,800 of those have been recovered, but the total cases is now over 10,000. In terms of hospitalizations, yesterday we were at 171 hospitalizations. That's up 2 to 173. In terms of deaths, we have an additional 6 Arkansans that have succumbed to COVID-19. That brings us to 161 deaths today. In terms of testing for COVID-19, we continue to expand our testing capability and strength in Arkansas, and so yesterday we did 4,849 tests. That puts us on target for reaching our goal of 120,000 tests over the month of June statewide, but that is a lot of tests that we're doing across the state for COVID-19. I did want to mention in the southeast region of Arkansas, there's always been a question, are we getting tested enough? Are we getting tested enough? Well, we broke it down by test by region, but also per capita. And so this is a per capita scaling of the test. And so in the southeast region, we have done 694 tests per 10,000 people. 694 tests. Statewide, the per capita amount is 565. And so you can see that there's a greater level of testing that we've done per capita in southeast Arkansas. And that's important to know that we're measuring the outbreak of COVID and any new information that's necessary to control the spread of COVID-19. Here in Jefferson County, we've had 666 tests per 10,000, again compared to the average in the statewide of 565. And then let's go on to the slides. I hope that can be seen all right. I think it can be seen on television as well. But you can see today's breakdown of 340 cases, which is down from the height of 450 a few days ago. But obviously it's too high, partly reflecting the number of testing, the amount of testing that we're doing. If you go to the next slide, you'll see the 7-day rolling average. And this is important because you see the second peak is higher than the first peak. And then secondly, you see in the second peak, there is at least a downward trend the last 2 days, I believe it is. Go to the next slide. And this is the key factor on hospitalizations as to the capacity of our hospitals. And here, again, you see the first peak on hospitalizations in April at about 110, and now we're up to 173 that's hospitalized. And so that's something we're continuing to watch. This breaks it down to the southeast region of Arkansas on the number of currently hospitalized. Now, don't let the graph mislead you, because the previous graph got up to 173, but this graph for southeast region, the highest point is 34. And so that means we're right now at a 30 that's hospitalized. Actually, it's a little bit down from that from yesterday, but you can see that that is a very manageable amount that's hospitalized because of COVID-19. The next slide, and this is the tests that are positive. And here again, you'll see I haven't talked about the percent positive in the last 24 hours because that's corrected, will be corrected information. But this is the accurate information showing our positivity rate in Arkansas. And the 10% line is drawn across there because that's the standard that is set by CDC, that you don't want to give above that, which we have been above that. But even though we are really focusing our testing on those vulnerable populations, the areas that we know we're probably going to get a lot of positive tests, even with that, our positivity rate looks like it's about 7%, something in that nature on the last day. And so those are continuing to be good numbers for us. And then is there another one? Okay, this just shows you, again, the increased level of testing that we're doing in Arkansas. Our goal, again, is 120,000 tests in June. And part of that is in our nursing homes and our patients as well as our staff. And so we are now at 28,862. We're on target to meet that goal. But let me tell you, as Dr. Smith comes in a moment, that's a lot of work by our hospital staff, our clinics, and the Department of Health to do and process all of these tests that are so important to know where we're going in Arkansas. And finally, before Dr. Smith comes, I know there's been conversation about where we go in terms of phase 2. I had a conversation with the leaders here earlier today, and I'll just tell you that we'll be making an announcement tomorrow on the Wednesday session as to the question answered as to whether and when we can enter phase 2. So stay tuned for that information tomorrow. And with that, Dr. Smith.
Thank you, Governor. I'd like to just make a few more comments on the numbers that the Governor's already shared. Governor mentioned that we've had 340 cases since yesterday, new cases. Of those, 34 were in correctional facilities, so 306 were community cases. And of our total cases of 10,080, 3,044 are considered active cases. Of those 3,044, 141 are in nursing homes and 139 are in correctional facilities. So we have 2,764 active cases in the community. The Governor's already mentioned that we had a net gain of 2 in our hospitalized, so we have 173 hospitalized. We have 44 currently on a ventilator, which is down 2 from yesterday. We have had 6 additional deaths, so we're at 161. And we have had 6,875 recovered, which is 245 more than yesterday. In terms of nursing homes, we've had 5 additional cases, so we're up to 488 total nursing home cases, and we've had 17 additional staff at nursing homes, so we're up to 332 for staff who have tested positive for COVID-19. The governor's mentioned our testing. We had 4,849 tests, and that puts us ahead of target for our goal of 120,000 for the month of June. The governor's already mentioned our testing per capita here in Southeast Region and in Jefferson County. I want to give some other details specific to the Southeast Region and to Jefferson County in particular. In the Southeast Region, we have had a total of 2,580 cases. Of those, 771 have been in the community, and 1,809 have been in correctional facilities. So we've had more than twice as many of our cases in correctional facilities as in the community. And so of those cases, we have currently 148 active cases in the community in Southeast Region and 109 active cases in correctional facilities for a total of 257 active cases. We've talked about deaths. In Southeast Region, we've had a total of 44 deaths. And of those, 32 have been in among community cases, and 12 have been in correctional facilities. Moving to Jefferson County, we have had a total of 559 who have tested positive in Jefferson County. And just, I don't think anyone here needs a reminder, but our first case in the state was here in Jefferson County, actually here at Jefferson Regional Hospital. This county and this hospital have been the tip of the spear. They've been on the front lines in our battle against COVID-19 and have done a remarkable job in containing and limiting the spread of COVID-19, although there continue to be challenges. Of those 559 cases that we've had here in Jefferson County, 320 have been in the community, 239 have been in correctional facilities. We have had a disproportionate case fatality rate here. The number of cases who have died in Jefferson County has been much higher than in the state overall. We've had 84% of our cases have ended up succumbing to COVID-19. That's more than 5 times the state average of 1.6%. And that's largely because many of our cases, especially early on, were in nursing homes here in Jefferson County, where we know that the risk of serious complications and death is much higher. So for Jefferson County, we have had a total of 28 deaths. Of those, 1 was in a correctional facility and 27 were in the community. We currently have a total of 52 active cases. 41 of those are in the community, 11 are incarcerated. And the numbers that I have, and I'm always timid about giving hospitalization data when I'm standing in the hospital because they could easily correct me if I'm wrong, so please do. But my information is that we currently have 4 hospitalized, 1 in the ICU, 1 on a ventilator. But I know those numbers change quickly, so you will have more current information here. I'd like to wrap up my conversation by just thanking the people here in Jefferson Regional for their partnership from the very beginning, and for the people of Southeast Region and Jefferson County for the work that you have done. This area has been hard hit in terms of deaths, but you've also done an extraordinary job of limiting the spread of COVID-19. It could have been much worse than it has been, and we value your continued partnership. So thank you very much.
Thank you, Dr. Smith, and I second that. I want to thank the whole community of Jefferson County for being such good soldiers in this fight and having success as well. And so with that, be happy to turn it over to any questions.
Governor Jay with KRK, I just wanted to get your response to Representative Sullivan's letter that he put out there saying that basically the northeast part of the state is going to open come Friday with or without your support. Just kind of want to know what you think about that and if you had a chance to speak with him on that.
I haven't spoken with him, and I get letters from both sides. I get letters saying you're going too fast. Slow down, don't open things up. I get letters that says you're going too slow, you got to open it up quicker. And so that's just one of the many letters that I receive. Dr. Smith and I try to make decisions based upon the public health guidance, based upon the data that we see, but also what is needed for the uniqueness of our state. We'll continue to do that, and we'll have further comments tomorrow during the session. Next question. Is there another right here?
Did you expect this second wave to be as large as it is?
No, but it just illustrates the fact that this is unpredictable. We haven't seen anything like this virus, and in fact, many thought that the second wave would actually be this fall. And across the country, we see a second wave coming, and I looked at it last night. Tennessee cases are up. You've got states all around us that the cases are up. Louisiana is an exception. They had that huge peak, and they're going down. New York is a huge peak going down, but many other states have had two peaks. As I've said before, you almost have a different pattern in the different regions and different states that we see. So in Arkansas, the quickness of the second peak was a surprise, and the fact that we don't know where it's going to go from here is something that is still a little bit unpredictable. Is there another question remotely?
Yeah, Governor, this is Andrew with AP. Going back to the question on the letter from Representative Sullivan, if businesses that decide to go into phase 2 ahead of whenever you plan on it, or in defiance of the restrictions, what kind of consequences are there going to be for them, and is Health Department going to be watching out for that? And also on whatever your announcement is tomorrow, is a regional approach, is that still off the table, or are you looking at that for whatever you announce tomorrow?
We'll make that announcement tomorrow as to how we're going to handle the question of phase 2, as to whether we enter it, when we enter it, and how we enter it. So we want to, obviously we've been studying this very hard. I indicated last Friday we're looking at it, studied it over the weekend. We continue to do that, looking at the data. We'll make a decision on that tomorrow. In terms of what we expect in terms of businesses and compliance with the public health guidelines, many of the businesses are licensed, whether it's a restaurant or whether it is a different type of facility. If they have a license, then if you don't follow the public health guidance, then that could jeopardize your license. But I understand that people want to some people want to accelerate. As I said, some people want to go slower, but we still have a rising number of cases here in many parts of Arkansas, and we want to make sure that we're taking the right steps to control it to the extent that we can, and that we want to be mindful of people. Whatever phase you're in, we still need you to socially distance, to wear your mask, to protect yourself. That's one of the constants through each of the phases. Yes?
Dr. Smith mentioned the nursing home population, but is there anything else that could be contributing to the high death rate here?
Dr. Smith.
We know the factors that increase the risk of death include older age, but especially underlying medical conditions. And we know that diabetes, high blood pressure, cardiovascular disease, chronic pulmonary disease, as well as weakened immune system, these all increase the risk of death. And so if the people who are being infected have those underlying medical conditions, then that increases the risk. But in the case of Jefferson County, really what drove it was we had a couple of nursing homes that were very hard hit very early on in the epidemic.
Yes.
You opened up the state to sports, youth sports, high school sports, and I know we've had some youth sports, baseball, softball going on, high school sports returning to workouts. How have you seen with the following regulations with that? Are there any reports on how that is going in the state?
The information I have is that the coaches, the athletic directors are being very careful to follow those guidelines. They know what's at risk. If you have COVID incidences as a result of a practice that doesn't follow the guidelines, that jeopardizes the whole program. And so they're taking it seriously. Everything I see, someone sent me a picture yesterday of a team actually doing some kind of a football drill socially distanced. Obviously it's not contact, but they have to train, they have to work out, and that's where we are right now, is to make sure that those guidelines for gym activities are followed. Obviously, baseball's in a different category, but I think we're all glad to see them coming back. We want them to come back more, but this is a step at a time when it comes to sports, trying to figure it out, get it done the right way, because we want the athletes to be safe as well as those that come to watch them. With that, thank you all very much for being here today. It's good to be in Pine Bluff. Mayor, we'll see you next time.